Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
In the types of fractures, we have extra-articular fracture or intra-articular fracture. In our extra-articular fracture is the fracture where the joint is not affected. So here the joint is completely intact. The joint is not affected in extra-articular fracture. So in extra-articular fracture, we can do closed reduction with hematoma. Hematoma can be preserved, but closed reduction is sufficient for the extra-articular fracture. Then we have intra-articular fractures. In intra-articular fractures, the fracture line is passing through the joint. Because the fracture line is passing through the joint, here the joint is affected. So in these cases, we will have to restore the articular surface, and if restoration of articular surface fails, then arthritis can result as a side effect. So in order to prevent this arthritis for intra-articular fracture, the main treatment of choice is we should do an open reduction is done along with a hematoma drainage is preferred for intra-articular fractures.
thank you and thank you for watching.